It's my pleasure to now introduce Dr. Vidhya Shankar Narayan. The title of the presentation will be Donor to Recipient Ratio in Surgical Treatment of Vitiligo and Piebaldism, a Systematic Review. Please.
I think my video is not starting.
Can you start with the video?
My name is Vidhya Narayan, and I'm doing my PhD on vitiligo at the Amsterdam University Medical Center. Unfortunately, we could not see each other face to face this year in India, but of course, I'm very glad that we got the opportunity to present our work virtually. So in the coming 8 minutes, I would like to talk about our study that we carried out about the various donor to recipient expansion ratios used in the surgical treatment of vitiligo and Piebaldism. I have no conflicts of interest or financial relationships to declare. So at our outpatient clinic, we regularly see patients with vitiligo or Piebaldism with large depigmented lesions, as you can see on the photograph of one of our patients. With vitiligo, we often start with topical treatment or with UVB phototherapy. But if this is not sufficient enough, and if the vitiligo is stable for at least a year, we offer surgical transplantation to achieve repigmentation. I would like to zoom in on the surgical bit because, as you may know, there are several different autologous transplantation techniques available. If you use these different techniques, it might be useful to keep in mind that these offer various donor to recipient expansion ratios. It may be unnecessary to explain, but just to be clear, when I mention a 1:3 expansion ratio, this means that the donor skin can cover approximately 3 times its size at the recipient lesional area. So which techniques offer which expansion ratios? Well, in general, these techniques can be divided in tissue grafting and cellular grafting. The tissue grafting techniques, such as split thickness, blister, and punch grafting, have low expansion ratios, which make them poorly suited for treating large surface areas. The cellular grafting methods include the non-cultured cell suspension transplantation and the cultured melanocyte transplantation. While these methods are preferred while treating large surface areas due to a small amount of donor skin needed. However, the expansion ratios for cellular grafting can vary widely. We have performed cellular grafting at our hospital, actually mainly the non-cultured method, but we kept using different expansions, so we were curious to know what the optimal ratio is and what is commonly used by others, because until now there's no overview or guideline on this, which is why we performed the systematic review, so mainly to provide an overview on the various expansion ratios used and to determine the influence of these ratios on repigmentation. So we performed a systematic literature search in Embase and Medline following the PRISMA guidelines and with guidance of our clinical librarian, who helped us determine our elaborate search, as you can see. A colleague of mine and myself performed the selection and the data extraction independently, and we extracted data on study characteristics, the transplantation technique, any additional therapies, and of course the donor to recipient expansion ratios and the repigmentation success rates. After performing the search in both databases, we removed the duplicates and then screened 925 articles on title and abstract. We mainly excluded records that did not mention vitiligo or Piebaldism or the cellular grafting techniques. Non-original articles were also excluded. After that, we assessed the full text, after which we primarily excluded retrospective studies and studies that did not include the ratios or repigmentation, which left us finally with 31 articles. These 31 studies included almost 1,600 patients in total and were all prospective trials or case series studies. Most articles included the non-cultured technique in vitiligo patients, and I wanted to highlight 2 randomized controlled trials that you can see in the table, because these trials directly compared different expansion ratios while using the non-cultured technique. What is remarkable is that in both studies, in Tecta and in Tawfiq, demonstrate that significantly more patients achieve more than 75% repigmentation in the lower expansion ratio groups compared to the higher expansion ratio groups. So what we did in the study to determine the influence of the expansion ratios on repigmentation is pull the results of the studies that stated the same ratios and the same repigmentation thresholds. We also took into account that other variables, such as disease stability and follow-up duration, were predominantly comparable between these studies. So what you can see in this table are the three different expansion ratios used with the non-culture technique in the first column, the studies in the second column, the total amount of lesions that reach more than 50% repigmentation in the third column, and the fourth column shows the total amount of lesions. And we added up all lesions of each expansion ratio group and then calculated the percentage of lesions that reach more than 50% repigmentation. As you can see, the 1.3 group has the highest success rate. And as you may also notice, that the percentage is decreasing when the expansion ratio is higher. We tested these differences with the chi-square test, showing a significant difference between the groups. We made the exact same kind of table, but this time for lesions that achieve more than 75% repigmentation after the non-cultured transplantation technique, and we found the same decreasing percentage and also found significant differences between these groups. As you can see in this last comparable pooled analysis table of lesions reaching more than 90% repigmentation after treatment, is that the same downward trend is visible while using a higher expansion ratio. However, for this last analysis, the difference was not significant. So, in conclusion, our study provides an overview of the various donor to recipient expansion ratios used in cellular grafting for vitiligo and Piebaldism. Expansion ratios from 1:1 to 1:10 were found in studies investigating the non-cultured method, and from 1:20 to 1:100 in studies evaluating the cultured method. Unfortunately, there was a high heterogeneity between our included studies in terms of repigmentation measures, vitiligo subtypes, disease stability, follow-up duration, and this once again underlines the importance of establishing a consensus on core outcomes. And finally, the results of our study indicate that higher expansion ratios lead to lower repigmentation percentages after treatment with the non-cultured cellular transplantation technique. For clinical practice, this should be taken into consideration before deciding which expansion ratio to use. And of course, finally, I would like to express my gratitude to my colleagues and supervisors for their help and contribution, and in particular also Dr. Wolkershofer for his guidance during the study. And thank you all for your attention, and hopefully see you next time in real life.
Thank you very much. It's very helpful because it's a key question, and honestly, I don't know the answer. So based on what you found in this analysis, you will suggest a ratio for 1:3. That's what I understood, or what are you suggesting?
Thank you for your question. No, so I would, based on these results, I would say maybe for lesions that are smaller, use the smallest expansion ratio, but maybe for lesions that are bigger on the body, even though the success rates are lower, and of course after discussing with the patients, I would suggest also trying the higher expansion ratio, but just keep in mind that the success rates could be lower for this higher expansion ratio.
Would this ratio depend upon the area in which the vitiligo lesion is located? For example, sacral lesions, would you need a lesser expansion ratio? And a face which repigments more easily, would that need a higher expansion ratio?
Yeah, so I think lesions on the face, that the success rates are higher there, but mainly because patients think that the face is, of course, important because that's a body part that is always seen. I would suggest using the smallest expansion ratio for that. So I don't know if that was an answer to your question.
Yes, it does, partly, but I think, I don't know whether this was looked at in the various studies, whether the results, the ratio with respect to location of the vitiligo lesion, was this one of the studied factors?
That is a very good question. Actually, we wanted to include that as well, but not all studies were very clear in where the acceptor region was. So unfortunately, I couldn't gather all data on that. But it is, I think, an interesting and important point to take into consideration. Yeah.
Maybe a last and quick question because we have to move on after that. Some attendee talk about, kindly discuss the reappearance of vitiligo patches after a few years of vitiligo surgery. Discuss the various modalities to prevent.
I'm just reading the question once again. So the question is, discuss the various modalities to
prevent the recurrences and the frequency of those recurrences.
For the repigmentation, you mean?
Yeah.
I think. So yeah, there are differences between, of course, also the cellular techniques and the tissue grafting techniques. We mainly focus on the cellular grafting because these expansion rates vary. However, for the tissue grafting techniques, actually it's pretty consistent. So the split skin grafting or the blister grafting all have a 1-to-1 ratio with, of course, high success rates. But if you want to treat larger areas, I would suggest using the cellular technique, but just keep in mind that the expansion ratios can vary, and of course that the higher ratios can give a lower success rate, unfortunately.
And just to try to answer to the last part of the question about to prevent the recurrences, to the best of my knowledge, there is no data on to prevent the recurrences on segmental vitiligo after grafting. But we demonstrated a few years ago that using twice weekly application of topical tacrolimus decreased significantly the rate of relapses. And we and others are using sometimes phototherapy for maintenance to prevent some relapses, but there is no strong data about that. It's still an issue.
Yes, that's true. Thank you.
Thank you very much. It was very interesting.
Yes.